Gout. It sounds like something you'd find in a spooky old house, right? But gout is all too real. It's a painful condition that affects millions of people. Gout causes sudden, intense pain in your joints. This pain can be so bad that it wakes you up at night. Gout is a form of inflammatory arthritis. It happens when too much uric acid builds up in your body. Uric acid is a waste product that's usually filtered out by your kidneys. But sometimes your body makes too much uric acid, or your kidneys can't get rid of it all. When this happens, uric acid crystals can form in your joints. These crystals trigger inflammation and pain. Gout usually affects one joint at a time, often the big toe. But it can affect other joints too, like your ankles, knees, and wrists. While gout can be very painful, the good news is that it's treatable. With the right medication and lifestyle changes, you can manage your gout and live a full and active life.
Imagine tiny, sharp crystals forming inside your big toe. That's what happens when you have gout. These crystals, made of uric acid, irritate your joints and cause inflammation. The result? Sudden, severe pain. Gout is a type of arthritis. Arthritis is a general term for conditions that cause pain and swelling in the joints. But gout is unique because it's caused by a buildup of uric acid. Uric acid is a normal waste product. Your body makes it when it breaks down substances called purines. Purines are found naturally in your body and in some foods. Most of the time, your kidneys filter out uric acid and you get rid of it in your urine. But when you have too much uric acid in your blood, it can form crystals that lodge in your joints. This is what causes the pain and swelling of gout. Gout usually comes on suddenly. You might be fine one minute and then the next minute you're in excruciating pain. This intense pain is the hallmark of gout. The pain often starts at night. You might even be woken up by it. The affected joint will be swollen, red, and tender to the touch. It might feel warm or even hot. The big toe is the most common site for a gout attack. In fact, gout in the big toe is sometimes called podagra. But gout can affect other joints too, including ankles, knees, wrists, fingers, and elbows. Gout attacks can last for a few days or even weeks. The pain usually goes away on its own, even without treatment. But future attacks are likely if you don't make changes to lower your uric acid levels.
Section 5. Delving deeper risk factors for gout. While anyone can develop gout, some people are more at risk than others. Understanding the risk factors can help you take steps to prevent this painful condition. Men are more likely to get gout than women. This is because men generally have higher uric acid levels. Women become more susceptible to gout after menopause when their uric acid levels rise. Age is another factor. Gout usually first appears in men between the ages of 30 and 50. Women typically develop it later, after menopause. Family history plays a role. If you have a parent or sibling with gout, you're more likely to develop it too. This suggests that genes play a part in gout. Your lifestyle choices also matter. Drinking too much alcohol, especially beer, can increase your risk of gout. Being overweight or obese also increases your risk. Certain medications can also raise your risk of gout. These include diuretics, also known as water pills, low-dose aspirin, and some immunosuppressant drugs. If you're taking any of these medications and are concerned about your risk of gout, talk to your doctor.
Section 6. Diagnosing gout tests and procedures. Diagnosing gout usually starts with a physical exam. Your doctor will examine your affected joint, looking for signs of inflammation like swelling, redness, and warmth. They'll ask about your symptoms, including when they started and how severe they are. To confirm a gout diagnosis, your doctor might recommend a procedure called joint aspiration. This involves using a needle to remove a sample of fluid from your affected joint. The fluid is then examined under a microscope for the presence of uric acid crystals. Your doctor might also order a blood test to measure the level of uric acid in your blood. However, a high uric acid level alone doesn't necessarily mean you have gout. Some people have high uric acid levels but never develop gout, while others have gout with normal or even low uric acid levels. Your doctor might also order imaging tests, such as an X-ray or ultrasound, to rule out other conditions that can cause joint pain, like osteoarthritis or an infection. An X-ray can also show if gout has caused any damage to your joints.
Section 7. Treating gout, finding relief from pain. The good news is that gout attacks are treatable. The goal of treatment is to relieve pain and reduce inflammation as quickly as possible. Your doctor will recommend a treatment plan based on the severity of your symptoms and your medical history. One of the first lines of defense against a gout attack is non-steroidal anti-inflammatory drugs, or NSAIDs. These medications, like ibuprofen and naproxen, are available over the counter. They work by blocking the production of chemicals that cause pain and inflammation. If over-the-counter NSAIDs aren't effective, your doctor might prescribe a stronger NSAID or a different type of pain reliever, such as colchicine. Colchicine is particularly effective for gout pain when taken within the first 12 hours of a flare-up. In some cases, your doctor might inject a corticosteroid directly into your affected joint. Corticosteroids are powerful anti-inflammatory medications that can provide rapid pain relief. Section 8. Managing gout with medication. Treating a gout attack is only part of the equation. To prevent future attacks, you might need to take medication long-term to lower your uric acid levels. These medications work in different ways. Xanthine oxidase inhibitors, like allopurinol and febuxostat, block the production of uric acid. They're the most commonly prescribed medications for long-term gout management. Probenecid helps your kidneys remove uric acid from your body more efficiently. It's an effective option for people who don't make too much uric acid, but have difficulty getting rid of it. Lesinurad is a newer medication that also helps your kidneys excrete uric acid. It's often used in combination with a xanthine oxidase inhibitor for people who haven't responded to other treatments. Your doctor will determine the best medication or combination of medications for you based on your individual needs and medical history.
Section 9. Lifestyle changes for gout prevention. While medication can effectively manage gout, lifestyle changes are equally important for preventing future attacks. By making healthy choices, you can lower your risk of gout and improve your overall health. One of the most important things you can do is to limit your intake of purine-rich foods. These include red meat and organ meats, seafood and shellfish, sugary drinks and foods, and alcohol, especially beer. Instead, focus on eating a balanced diet rich in fruits, vegetables, whole grains, and low-fat dairy products. These foods are naturally low in purines and provide essential nutrients for your body. Maintaining a healthy weight is also crucial for gout prevention. Losing even a small amount of weight can significantly lower your uric acid levels and reduce your risk of gout attacks. Section 10. The power of diet in gout management. What you eat plays a significant role in managing gout. By making smart food choices, you can lower your uric acid levels and reduce your risk of painful gout attacks. Start by limiting foods high in purines. Purines are broken down into uric acid in your body. High purine foods include red meat and organ meats like liver, certain seafood like anchovies, sardines and shellfish, and alcohol, especially beer. Instead, fill your plate with low purine foods, fruits and vegetables, whole grains, and low-fat dairy products. Drinking plenty of water is also crucial. Water helps to flush out uric acid from your body. Aim for 8 glasses of water per day. Some foods and drinks may even help to lower uric acid levels. These include coffee, cherries, and vitamin C-rich foods. Talk to your doctor or a registered dietitian to create a personalized gout-friendly diet plan. Section 11. Taking charge of your health living well with gout. Gout can be a painful and disruptive condition, but it doesn't have to control your life. By taking proactive steps, you can manage your gout and live a full and active life. Here are some key takeaways to remember. Understand your triggers. Identify and avoid foods and drinks that trigger your gout attacks. Stay hydrated. Drink plenty of water throughout the day to help flush out uric acid. Maintain a healthy weight. Losing even a small amount of weight can significantly lower your risk of gout, and take your medications as prescribed. Follow your doctor's instructions carefully, and don't stop taking your medication without their guidance. Living with gout requires ongoing management, but with the right approach, you can keep your symptoms under control and enjoy a good quality of life. Remember, knowledge is power. The more you understand about gout, the better equipped you'll be to manage it effectively. Like, share, and subscribe to Cal Wayne Health TV.